Alright, I just checked my orders, and my patient Eugene Williams is to receive a dose of furosemide before his second unit of blood. So I'm going to get that ready. Checking the MAR. Furosemide 40 milligrams times 1 dose to be given between first and second PRBC via IV piggyback. I have my 3 syringes. Checking the expiration date. They're all good. I grab my furosemide. Expiration date's good. It's clear. With my syringe and my access device. Perfect. I'm gonna grab an alcohol swab. Clean the top.
You're ready, I'll just unpause it.
Just stop it.
You want me to stop it?
Yeah, because we have to upload 3 different videos.
Oh. I think I can just press this button. Huh?
Yeah. No, not to edit it.
Alright, whenever you're ready.
Right?
Yep. Okay.
Can you verify that it's dose accurate? I'm going to put a label on this that I pre-made. Take my furosemide, grab my MAR, and I'm doing my checks, make sure I have the right stuff. So first thing, I have patient Eugene Williams, date of birth 9/22/45. I have furosemide, 80 milligrams in 2 mLs. So in this dose I have 40 milligrams, which is the order for 1 ml. Due now before his second pack of red blood cells. Given IV push. So I have Eugene Williams, furosemide, 40 milligrams, which is 1 ml. Due now via IV push. I have Eugene Williams, furosemide, 1 ml. Due now before his second pack of red blood cells. And that's it, that's right. So I have that. So then I'm going to go into his room. Hi Eugene, it's me again, Kaylee, your student nurse. How you doing? He says good. I'm like, okay. Well, we finished that first pack of blood, and we're about to do the second. But your doctor has ordered for you to receive another medication, okay? So before I set up that second one, we're going to administer this med, okay? He says, okay. Eugene, can you tell me your name and date of birth? He says Eugene Williams, 9/22/45, and it matches what's on his bracelet. Perfect. I'm going to provide for privacy. Okay, Eugene, the medication I'm going to be giving you today is furosemide. It's a diuretic. Have you had that drug before? And he tells me yes. Okay. So you know it's going to help take fluid off your body, and it's going to make you go to the bathroom a lot? He tells me yes. Okay, good. So you know it's really important when you have to go to the bathroom that you call and you ask us for help, because the drug can make you feel dizzy sometimes. Plus you're going to have all these lines running with your blood. So it's really important that you use your call button and ask us for help when you need to go to the bathroom, or I can set you up with a urinal and you can use the urinal in bed. And he tells me yes, that he understands. Perfect. So next I'm going to check his site here where he has his pick. I'm checking for redness, edema, ecchymosis, drainage, and amount of drainage. And everything looks really good. I'm going to palpate. Eugene, do you feel any pain at all? He tells me no. Perfect. So I'm going to grab my first saline flush, but before I do that, I'm just going to do my other checks right away. So I have Eugene Williams here. He's getting furosemide, 1 ml, due right now. Again, I have Eugene Williams. He is getting furosemide, 1 ml. Actually, I wouldn't have this in the room if this is labeled. But that's okay. I brought it in with me. Eugene Williams, furosemide, 40 milligrams, which is a 1 ml dose. Due now via IV push. Eugene Williams, furosemide, 40 milligrams, 1 ml, due now via IV push. And one more just to play safe. Eugene Williams, furosemide, 40 milligrams, which is 1 ml, due now via IV push. So that is correct. And looks good.
Says for this amount, it could be pushed in over 1 to 2 minutes. So people look at the clock.
I checked the chart before I came in, and we're using this red line for blood and the white for medications. So I'm cleaning this line. Nice and clean. And I know that this is an appropriate gauge needle. Catheter, I mean, I've been giving him drugs through this catheter all day. I'm monitoring the site to make sure it's running nice and clean.
Watching the clock on the wall.
Perfect. All right, and then I'm going to do the furosemide. I checked in my book. It is compatible with normal saline. I'm also going to administer it over 1 minute. I'm going to use the clock over there.
And as far as compatibility goes, we did find out that it's not compatible with a lot of antibiotics, which we're not using now, so it's fine. And same with normal saline, it is compatible with that.
Yeah,
You know,
and I can look at it before I do it. Cause then isn't she taking it, you're supposed to do it all? No, you said we could do it twice, you could do 2 videos in case you lost one.
I know, but
And then we're
once you
gonna go
start,
ahead and
you
put in
keep
another
going.
5 milliliters.
Well, I thought we were
just to
supposed to
wash
upload
out.
our first one, then we'll do our second.
This will
If
actually
you
be
want,
good
yeah.
with push method.
That's, yeah, so
It says
I'm
it
uploading
fuse
mine
up
right
the
now,
same
and then I'm
amount
gonna
of
do
time
the
as you infuse the drug.
second. No,
So again, we'll do that in that,
no,
well,
no, I'm uploading that
2-minute
one,
time frame.
so I know that that one's done. They're making 3 separate videos?
Yeah, just two.
Yeah, you're already pushing them whenever you're second. Secondary two.
What?
For time's sake, we're going to say that was a minute.
You're only doing the 2 things that are in that package for us, right?
Right, plus the prioritization, you know, yeah, plus making sure your math is right and doing the right way.
Clean this report again.
I'm confused as hell. Cause, I don't know, mine has, I have a stat, I have to do that.
I want to, so I'll do that first.
So you
So you have to give you a
we'll go ahead and clean this up.
So the first 5 mLs I'll administer over 1 minute. The second I'll pulse in.
And then if available, you have the little green capsule put on there to help fight infection.
These are the new orders that you got, that you just got. Yeah. So this is what you're gonna want to do.
Alright. For lifestyle stuff, like because you know the patient probably push it a little bit slower. Because it's always have a parent there to keep your child still, just make sure it's stable and fine. And that's it.
I don't know, I don't know.
All right, that was 1 minute. Now I'm going to pulsate the remaining 5.
No, it's not, you do what you need
I would clamp this
Everybody's doing food,
because it's appropriate and it's part of my facility protocol. So that's clamp. Put that away. Wash my hands. Monitor my patient for any adverse reactions.
And I'm here to give you your packed red blood cells.
Okay.
Gonna verify your name.
And you can go ahead and pause, yeah.